Hi, today I'm going to talk about the cases where not everything goes according to plan. This video was inspired by a student of mine who I've been mentoring lately, and I've been helping her with some clinical cases, and she was telling me that she's been very frustrated because she sees that the videos I post, some comments, people on online groups, other teachers tell her about cases that they treat in one session, and sometimes she struggles. She doesn't get the kinds of results that she expects to, so she gets very frustrated. And I think that this highlights a problem that's very common amongst the more public figures of acupuncture and TCM, people like me that have a YouTube channel, that have some presence, maybe teachers, maybe people that publish books. And usually what we do is we publish the good cases. We publish the sciatica case that we solved in one session. If you'd like to learn more about the techniques that I talk about in my videos, you can check out my courses. The links are available below and in the cards above, so just check them out. We'll publish the facial paralysis case that we treated in 1 or 2 sessions, or we'll publish the case that we bled 1 point and everything was okay. But usually we don't advertise the cases that give us problems and that maybe we had to do 3, 4, 5, 10 sessions to get good results. And this happens because of the nature of this medium, of course. So you come to my channel to learn, so you want to hear about cases where I got good results so you can emulate it and get good results yourself. But we need to be careful because nobody gets 100% perfect results. That doesn't happen. I don't care how good you are, and be very wary of people selling you something or showing their work, telling you, oh, every case I get like this, 1 session and it's solved. You might have a fantastic success rate with some pathologies or with most pathologies, but nobody gets 100% results. I've been fortunate enough to learn directly from some of the greatest masters of acupuncture of our time. I've studied directly under such teachers as Tung, several first-generation Master Tung disciples, such as Dr. Young and Dr. Paul Carson. I've learned directly under Jiao Shunfa. So I've seen a lot of amazing acupuncturists work. And I've seen some of these acupuncturists fail. I've seen them receive patients during seminars and not get results they expected. So if they fail, we fail, everybody fails. If you hear someone saying, oh, facial paralysis, I treat every case in 1 session, it's solved, you have 2 possibilities. Either they're lying to you, or they haven't treated enough facial paralysis cases where they see a really hard one that will stump them and they won't get results in the first session. Or even if they get results, they don't get the results they expect and they need to do a 2nd, 3rd, 4th, whatever. 10 sessions, 20 sessions. We've all struggled with these kinds of problems. And because of the nature of this medium, as I told you, we tend to publish our successes, and this is, even if you're doing it with the best intentions, it's dangerous for 2 things. One of them, it might create unrealistic expectations on patients that might see our videos or our posts. So they think that, oh, this is 1 session, and then their problem is slightly different, and they go to an acupuncturist and think, oh, this acupuncturist doesn't know what he's doing because after the first session I wasn't cured. Sometimes even if they get good results, but since they don't get a complete recovery in 1 session, they won't be satisfied because their expectations are too high. And even more dangerous is we are creating anxiety and unrealistic expectations on our students and on less experienced acupuncturists that follow us, that see these cases we describe, and then when they apply the things they learn from us, or the other techniques they use, they don't get these results in one session. Of course, as you progress, you start getting better, you start getting better and better results, but there will always be the cases where you can't get the instant improvement in the first session, or you get the improvement but not as much as you want to. And it's important for the students not to get demotivated. So heed these words. Everybody fails. Of course, you need to strive to get the perfect result every time. That's a healthy attitude, but you need to know that this is an impossible standard. So strive to be better, strive to get better and better results, strive to get quicker and quicker results, but know that you will fail sometimes. The idea is, with every day, with every year that you practice and that you study, the success rate starts getting higher and the fail rate starts getting lower until it's almost zero, but you will always have patients that give you some kind of struggle. Be it because the pathology they bring is harder than what it might seem on the surface, so it's more complex. Be it because some people just don't respond well to acupuncture. It's a very small number of people, but some people just, their body for some reason just doesn't respond to our treatments. It can be because you've missed a diagnosis or you missed a treatment strategy. But even if you are perfect in all the approach that you're doing, some cases just are impossible to crack with one session or with one needle or with one or two needles. So be prepared for this, because it happens to every one of us. And this brings me to another important thing that every acupuncturist should have, which is a group of peers they can discuss the cases with. So if you don't have friends that studied with you, people that work around your area, try to find it online in Facebook groups. It's a very good resource for you to have like-minded people you can discuss these hard cases with, so they can give you their input, sometimes even suggest a different approach, suggest a different technique. Sometimes they won't have a solution, but just discussing it will make the cases easier. And now to finish this video without being a hypocrite, I'm going to tell you about a case that I failed with. I failed to meet my standards. It was a very hard situation for me because, as every one of us here, I want to get good results, I want to get quick results. And this was a facial paralysis patient that I started seeing last year. And usually in these cases, I'm very confident because I've seen a lot of them. I know that most of them we get a quick result. And this case had everything to be good. It was a young patient, below 40 years old. And he came to me in the week after he suffered the facial paralysis. So he came quickly. It was a recent problem. He didn't have any other problems that suggested that this might be a hard case. So I entered confident. He had the left side of his face paralyzed. His eye couldn't close completely and his mouth was askew. We do the first session and I got absolutely no result. Saw him again after a few days and got almost zero results. I managed the eye to change a little bit, but I couldn't get real results. The patient kept coming. We kept trying different approaches. I discussed it with my colleagues. I tried Master Tung, bleeding, balance method, cranial acupuncture. I threw everything I had at him. I used direct moxa. I used direct moxa on the face. The patient just didn't respond well to anything I did. He was doing physiotherapy too, at the same time that we were doing acupuncture, but it took me almost 20 sessions to get him to close the eye completely, and we never could get the mouth to be completely normal. There was always some difference from the left to his right side. So as you can see, maybe you're from that side looking at my classes, say, oh, he must get great results all the time. No, I fail like everyone fails. So if you fail, of course, this is motivation to keep studying, learn more, get better, but don't let yourself be discouraged by this. You will always have this struggle, and trust me when I tell you that The cases that you'll remember are the ones that you failed, because those are the ones that made you think, that made you look for different strategies, made you study. So these are the cases that make you grow. When a patient comes with sciatica, I use one needle and the patient goes back without any pain, I don't go open a book after this, because I got the result I wanted, maybe even better than I expected. The cases that make me want to go study again, maybe go take a class again, maybe go discuss the case with someone else, are the cases that I struggle with. So don't fear this struggle and don't get discouraged by it. Just keep moving forward and know that everybody else fails too. Thank you so much for watching this video. If you liked it, don't forget to like and subscribe, and I'll see you in the next one.